Hello, my name is Micah Tatum. I'm a board certified pediatrician and current pediatric and congenital cardiology fellow at Nationwide Children's Hospital. I earned my bachelor's in biochemistry and cell biology at Rice University in Houston, Texas, where I worked as a tutor for high school students and a mentor for socioeconomically disadvantaged students in the Third Ward area of Houston. I received my medical degree at University of Texas Southwestern Medical Center in Dallas, Texas, where I served a leadership role for prospective medical students and worked with Black Men White Coats organization for mentoring underrepresented and minority youth around the Dallas area and exposing them to healthcare and medical careers. I then completed my pediatric residency training at University of Washington and Seattle Children's Hospital, where I served on the interviewer committee and application reviewer for residency applicants. Cardiology is a rapidly evolving field with plenty of avenues for specialization. In terms of my own post-graduation plans, I'm considering pursuing a subspecialty in heart transplant and cardio-oncology. This hits very near and dear to me, being a cancer survivor, and I've been interested in the chronic effects of chemotherapy on heart function and cardiovascular risk stratification. I'm also interested in pursuing advanced imaging and learning more about 3D echocardiographic techniques, as well as cardiac MRI, and trying to implement artificial intelligence or machine learning techniques in rendering heart models and planning surgical interventions. For university, I received scholarships from the Omega Sci-Fi Fraternity, the Leukemia and Lymphoma Society, as well as the San Antonio Rotary Club as well. I led the alternative spring break trip to the Ramadan House at Children's Hospital of Georgia, where we provided meals and relief to families who had their children undergoing treatment. I also was a volunteer at Texas Children's Hospital as well. During medical school, I led a mission trip to Santo Domingo in the Dominican Republic, where we provided healthcare and supplies over the period of 10 days. I also served as the chair of the Pre+Op Committee. I was the student government's deputy senator and president of the pediatrics interest group. And then in residency, we earned the Barbara Ross Lee Diversity, Equity, Inclusion National Award. I also served in the Washington chapter of the American Academy of Pediatrics and as a member of the Washington State Drowning Prevention Network. Getting into medical school is certainly not for the faint of heart. It is a very challenging process. There are quite a few things you can do, and I think one of the most important things is always keeping that why, the reason why you're doing this in mind. Why do you want to go into this field? Why is it so important to you as well? And then in addition to that, surrounding yourself with people who you know, they might not be doctors, but people who can be advocates for you and people who can be a good support system. And then when you're in that environment, you can seek mentors. And I think mentorship is another crucial part of this. I think what makes my approach to medical and pre-medical advising unique is I really like to break things down foundationally and try and really go back and keep that central theme of what is your story, building your story in a way similar to medicine where you have to distill a lot of information into more digestible bits for patients, for universities as well. Your life story is a pretty big thing and you need to find ways to drill that down, digestible bits. So with that, what I mean is I want to see or I want to talk a lot about experiences that show a clear pattern of interest and how they're central to you. Also experiences of tenacity, experiences where you persevered, those times where you didn't quite get the thing you wanted to, but you kept on. Because at the end of the day, medical school, they're going to teach you to be a doctor. You don't need to come in with the knowledge to do that. That's their job. But if you have these qualities, that's going to help you tremendously. I think my greatest strength lies in my empathy and approachability. In terms of the approachable part, I always try my best to make that central to anyone who I am mentoring or coaching or consulting for. It's very important to be able to keep that open outlook on the person who's advising you. And I've been in environments where the learning environment didn't feel very safe, and I know the effect that they can have on someone. And so I always want to make sure that there's no concern or anything whenever someone's approaching me for guidance, for advice, or just even looking things over. I've been in several of your positions as well, but then not only that, I've gotten to have a peek behind the curtain and be part of those committees where we're reviewing applications or talking about interviewers. And this always goes back to, what's your story? What is the story? Who is this person? Ironically, my passion for wanting to help students through this medical and pre-medical process, application and interviewing process, didn't actually come from a place of interviewing or much academic prestige. Honestly, if I have to think about it, it really comes back to I was there. Not only was I there as an applicant, but way even before that, I was a patient. I'm a cancer survivor. And whenever I had those exposure, that was my first exposure to healthcare, honestly. And I mean, I had the question to myself of like, well, what would I like to see in a doctor? And I became more interested in medicine. Then I started to kind of ask myself the other question, which is, what kind of doctor do I want to be? And I think having that really inside look where I was once the patient, now I'm a doctor, really kind of helps me in guiding those who want to go into this field, not only know like what is the things that patients think are important, but also the things that you're going to learn that are going to be important as a physician as well, and someone along that process. So I feel like I just kind of have this full scope of things, and I really want to make sure that the future of people, the future of medicine, are able to have both of those experiences with them as they go and complete their journeys.